I will call this meeting to order from this end of the bench. Since we're waiting for Linda, why don't we start out with the staff reports?
Okay.
That'll teach you.
So first of all, before we start, is there anybody who is looking to offer public comment this morning? Okay, seeing and hearing none, I guess we'll go ahead and move into staff reports. So good morning, everyone. It's good to see all of you. I have just a few things. And so first of all, in the throes of the area plan development, that is our plan for how we will deliver services over the next 4 years. I have a deadline of the middle of July, so I will be bringing an update here to the July commission meeting to just give you all an overview of what we've included in the plan for this year. As I've been working through the budget portion of the area plan, I am concerned. This year in September of 2024, our extra funds that we received with ARPA all expire. We have been utilizing those funds to cover some of the increases in costs. So we've talked about the increases in transportation costs. We talked about the increases to the Meals on Wheels with the new contract. When I did the projections for the next year for Meals on Wheels, it's coming up that we're going to need about $500,000 to serve the people that we're serving. So we can make it this year with the ARPA funds that are left over, but the next year, FY 2025, I'm concerned. And so hoping that we don't get into a situation where we have to have a wait list on programs that are so essential to individuals in our community to help them stay at home. But we are going to keep a close eye on it over the next year. Like I said, I really do hope that we don't get into that situation, but there is potential for transportation programs and for Meals on Wheels, especially since the prices of those two have gone up exponentially in the last couple of years.
So if this continues, the commission is going to need to turn toward fundraising.
I was going to say, we can always pass the hat around at the beginning of every meeting, right? So. Yeah. Speaking of budget as well, there's still no update yet on the state budget amendment. And so if you remember right, when we were going through the interstate funding formula exercise, an amendment was put forth for $700,000 to cover the agencies on aging that were negatively impacted by the change to the interstate funding formula. That $700,000 is still in play, but there's uncertainty on when the budget will be brought back up and whether it will be passed before July the 1st. So we can't count on that money, but it still is potential to be added. And that $700,000 will be divided across most of the agencies on aging in the state. So it's not going to be a huge amount, but it will be some. Onto the county board elections. We all had our elections last week and they declared Friday afternoon the 2 top candidates who will be the Democratic candidates in the fall. And that was Maureen Coffey and Susan Cunningham. We understand that the county board is going to appoint somebody to complete Katie's term. So she's departing July 1st, I believe it is. And so somebody will be appointed to complete her term from July to December. We have not heard who that will be yet. And we also have not heard who our liaison is going to be as of July 1st. So we'll update you as soon as we learn. Metro has initiated a new half-price fare program for individuals specifically who are SNAP recipients. For our population, it will cover individuals from 60 to 64 because individuals who are 65 and older already qualify for half-price fares through the Senior Smart Trip. But exciting that we can expand it now to the individuals who are 60 and older. And of course, it applies to the greater population of adults. Just our specific population would be the 60 to 64 segment. Okay. Big shout out to the age-friendly Arlington Task Force. We've talked about this a couple times, but Their first 5-year report was accepted by AARP, and Rachel received the official, we'll find a place, maybe out in the lobby, we can display it or something. Yes, so we'll find a place to display that. I also brought printed copies of the report with me today, so each of you should have one at your seat. Others, if you're interested in a print copy, just let me know and we'll figure out how we can get you a copy. And then I've also printed out copies of the Community Engagement Forum report for you all to have. And then also the path goals. So if you remember back in October, we went through the path exercise and developed some goals for the next four years, 2027. So for the next 4 years. And so I printed a copy of it so you all could have it. And, we'll be using that quite a bit over the next year. It is feeding into my area plan development along with the results from the Community Engagement Forum. But we will, it's also available as you're developing the next 5-year plan for age friendly as well. So, and I think those are my updates. Any questions for me? Yeah.
I have a question about the Metro program that you mentioned, the
Yes.
half price. Does the AAA assist older adults in accessing that Metro half price fare program?
We
Like,
certainly
when
can.
they apply
Yeah,
for SNAP
yeah.
benefits, is that kind of
So we're-
coupled with?
So we actually don't do this, we don't help with the application to SNAP benefits. That's within the Economic Independence Division. But certainly if somebody is calling us and we're referring them to SNAP, we would also be mentioning this new program to them.
Okay.
And Shandy and I haven't talked about this yet, but also, as the agent's ADRC staff is talking to individuals, they will be asking, especially if they're in that 60 to 64 range, and we know that they have SNAP,
Mhm.
we will be talking to them about this program as well. Okay. Carlos has a question. Carlos.
Hello, how are you? I have a quick question and a request.
Yes.
One, I put in the chat in terms of the need for the Meals on Wheels. Are those numbers an assessment, a projection based on current analysis? Or are you looking at the worst case scenario?
So the way that I developed those numbers, Carlos, is I looked at the number of meals each month that we have delivered to the individuals who qualify for the subsidy, and then ran projections based on that out for the next year. So it's not worst case scenario, but it's not best case scenario either. It's kind of in between the two. So.
And then my request is if Roland, you could do me a favor and get a printed copy of the report for Age Friendly, I would appreciate that. And I will see you soon.
Okay, perfect. Thanks,
Helen.
Carlos. Any other questions? for
Hey,
me?
Helen,
Yes.
this is Anthony. I had a question.
Yep.
Sorry, I'm dialing in. I'm at the
Go ahead.
doctor's office. I heard you mention on the FY 2025 concerns with Meals on Wheels and transportation. Is home care bundled in that? Because I know we contract with 2 home care agencies. I'm not sure how often their contracts are up for renegotiation, but I imagine their prices will go up. And are they looped in, or is there any thoughts on how that might be affected?
So those 2 contracts are for our community living program, which is the in-home services. The Agency on Aging in our area plan budget provides some funding to that program, but it's not total funding for that program. So we contribute what we can, and then there are other funding sources that contribute to that program as well. So yes, they actually do get a cost increase every year when their contract comes up for renewal. So we did have a little bit of an impact this year. It's part of what caused us to do the evaluation. If you remember back in March and April, when we had to do some cutting of hours and of service, that was in part due to the cost increase that is part of the contract. And so, yes, that is factored in. We are also looking at that program more holistically. And having to decide, I think, just based on need, who most qualifies for that. So we're looking at a lot of the requirements. So for example, with home delivered meals, right? During COVID, we were able to relax the definition of homebound, right? So we were able to include more people who weren't necessarily meeting that exact definition of homebound. Now that the public health emergency is lifted, we are going back to that more strict definition. It's the same with the community living program. The individuals need to be homebound to qualify for that program. And so we will be looking at all of our programs and making sure that we're following those restrictions as well when we're looking at who remains in the program, especially as costs start getting tighter. Okay, does that help, Anthony?
Yes, thank you, Helen.
All right, any other questions for me?
Okay, Rachel?
All right. Well, good morning again, everyone. I feel like that's a good segue into, there are some proposed updates to the Older Americans Act. This is the federal sort of legislation and policy that guides a lot of the Agency on Aging programs. So the AAA programs that Helen just mentioned, like the home delivered meals, the homemaker in-home services programs, are all, we all have to adhere to the Older Americans Act regulations. And for the first time in, since 1988, I don't know where everyone was in 1988. That was a long time ago.
I don't either.
So there's a lot of updates that are needed to the Older Americans Act. We are currently waiting on some of our national partners of, sharing some updates, possibly guidance. And then we know US Aging is going to do a survey of all of the 600 plus agencies on aging throughout the US. So this is also an opportunity for us to share some of our feedback about the regulations that really do have a direct impact on our local programs. So we'll definitely keep you updated with that. August 15th is the deadline for comments, but we will definitely be in touch. And just a big shout out to Shandia. She helped to put together this amazing report from our community engagement forum that we had in March. We use this feedback, as Helen mentioned, to shape our area plan, to shape our contract with the state, but also really our strategic plan. And so we will be gleaning from this, from the listening sessions, from the community feedback that we have throughout the year, for the area plan, for the Older Americans Act regulations, and other planning documents that we have. I do want to give a shout out to, she's not here today, but Andrea Walker was selected by Volunteer Arlington for the walking school bus. Like, I don't know if you had any hand in that, but I believe it's July 13th will be the Volunteer Arlington recognition. And so hopefully everyone will be able to attend. We can share that in the follow-up. But attend, show the support for Andrea and for the Positive Aging Inclusion and Enrichment Committee for the walking school bus, and just all the work that went into that. In addition to Andrea's recognition, I also want to give a shout out to Anthony Glaze. Mr. Glaze is part of our Aging and Disability Resource Center. He reports to Shandia, and he was recognized by the county board last week at one of their public meetings as just a truly outstanding employee for the work that he's been doing. And we'll talk a little bit more about homelessness shortly, but just helping older adults and a crisis that he recently helped to resolve. And we can share the video from the county board recognition, but just a huge shout out to Anthony. Our Adult Protective Services program is still in recruitment for a human service clinician. That team has been down, and Joanne, the supervisor, has really been pitching in. But we completed second round interviews, and so hopefully we'll have an announcement soon to have that position filled. And then also on the personnel updates, I know there are many champions of the RAP program that provides mental health services in long-term care settings. Alice Straker, who has been the program manager of that program for quite a few years, I think 6 or 7, she's retiring this week. So just a huge shout out to Alice and her leadership over the years. And then we'll have announcements soon with the recruitment for the RAP position. But it's a very important program, and they've expanded recently in terms of a dementia support community-based program. So there probably won't be a lot of gap between when we announce for the new director for that, but we will have updates on that soon. I think that's all I have. I don't see my word.
Yeah, I would note also that this is another record. It's the thickest report we've ever had. I guess then, if there are no other questions, our next presentation is by Rachel on eviction. And eviction is progressively a more difficult and heartbreaking problem. It is one of NVAN's priorities this year, as a matter of fact. Rachel, you want to talk about that?
Yes. Hello, Chair Keller. Good time. No, thank you all for inviting us to share a little bit about evictions, shelter, and homelessness. And thank you to Audrey and just the invitation from the Housing Committee of the Commission on Aging to present on this important topic. I'm presenting today with Dr. Shandia Johnson. Would you like to introduce yourself, even though she needs no intro?
Hello, everybody. Shandia, so nice to be here in person. Just grateful to be able to talk about this really important topic with everybody and to get, any type of support, advocacy that we possibly can, and making sure that we eradicate this horrible happening, for all of us.
Thank you. And Shandia is the director of our Aging and Disability Resource Center. And so she really is sort of the front lines for what we're seeing of adults 60 and above who are experiencing homelessness and in need of shelter requests and referrals. Just a quick, you've probably seen some of this before, some of the demographics that we have around our older adults in Arlington, but also wanted to include some of the housing trends that we're seeing. So the population of adults 60 and above in Arlington continues growing. We have about 36,000 or more adults age 60 and above, a poverty rate for our older adults of 9.2%, but only 4.8% are accessing SNAP benefits. So Kathy, I think even to your point, there's more work that needs to be done around connecting older adults to benefits. We have about 14% who are veterans, and that includes World War II veterans through Vietnam for our older adults. Of our older adults, 27% speak a language other than English. And I think in our ADRC, we have over 30 languages registered each year that we're serving. But a trend that we're continuing to follow is that older adults may be more likely to live alone. Of 65 and above, because that's what the census has, it's about 36%. But when you break that down by zip code, it's much higher levels in particular zip codes, like 22203, 56% live alone. When we look at some of the housing trends for Arlington as a whole, from the last Arlington profile, the average rent is about just under $2,300 per month. And the average assessed home value is just under $750,000. So for individuals on fixed income, that can be a significant burden. For the older adult housing trends that we look at, the majority do own their homes, about 66%. But of those who own, who spend 30% or more of their income on housing, that's 24%. So when somebody spends 30% or more of their income on housing, that's known as housing burden. For the renters, which is about 34% for our older adults, almost half of them are spending more than 30% of their income on rent. But fortunately in Arlington, we do have housing subsidies. 600 receive housing choice vouchers, or what was formerly known as Section 8. We have a local program called Housing Grant, and 424 individuals receive housing grant. And then just under 900 receive real estate tax relief, a program to help with their property taxes in their homes. So as Jim mentioned, the Northern Virginia Aging Network is really looking at preventing evictions. And we're looking at what are some of the underlying challenges, not just for older adults, but that are impacting eviction rates and the rises in homelessness. No limited or fixed income is one of the big causes, but it's really tied to a lack of affordable housing. For the individuals that we are serving, we have some who do not have income. They maybe didn't apply for Social Security or early retirement. They may not have worked the number of credits to qualify for something like that. Or they may have recently kind of come to a financial cliff. We see this often with the loss of a spouse or the loss of a job, of a source of income. For many of the older adults that we serve, they do rely solely on Social Security as their primary source of income. And depending on when somebody qualifies for Social Security, that payment may vary. Some people may get it on the 1st, some may get it on the 3rd, some may get it on the 15th. And if your rent is due by the 5th, you really have to plan ahead for that. It can have an impact. And then the cost of home repairs. We do have great partnerships with groups like Rebuilding Together, but sometimes a significant cost of home repairs can wipe out someone's entire savings. In Arlington, I think recognizing the average rent value, the rent continues to rise. There's high costs of maintaining housing, of affording property taxes, and then even with condo fees. We see this quite often as well, as that condo fees can be an additional burden for individuals. And then additional barriers, and Shandia will talk about some of this as well, but we see things like behavioral health issues that may be impacting someone's housing, a mistrust of government and wanting to reach out and access government services or supports. We've seen landlords who are selling properties or renovations that force individuals who have lived in homes or properties for 40+ years have to move and relocate to an entirely new neighborhood, sometimes outside of Arlington. I know Cheryl is a big passion for this, but looking at technology and really, who has access to technology and the ability to access some of the different online resources that are available, to sign up for waiting lists, to apply online for housing, and then transportation access to go and apply for apartments. The lack of affordable assisted living.
Disconnected.
Oh, no. Are we back? Can you hear us, someone?
Yes.
Sorry about that. Okay. The lack of affordable assisted living. This is something that for quite a few of the older adults who are currently in shelter are in need of affordable assisted living. However, the wait list for programs like partners that we have may have year-long waiting lists for an assisted living that's subsidized. And then immigration status. We're seeing this more frequently of someone who may not have the opportunity to become a U.S. citizen who loses their housing, and we'll share a story in just a moment. We have a slide here on some of the causes, and we've talked about some of the causes of homelessness, but this is also a racial equity issue. For African American, for Black Americans, they're at significantly higher risk of homelessness than white Americans. And in our performance measurement plans, we look at the racial breakout of this, but there are many ongoing effects that contribute to this, including segregation, redlining, rental housing discrimination, previous incarceration or evictions that may access future housing or benefits to care and services. We also are seeing a trend, and we'll talk about this in just a moment, of the risk of homelessness for older adults who are on fixed income. They may be underhoused. We've talked about the technology, transportation options, and then not qualifying or not applying for available benefits that may help their current situation. And one example of that is that some of the individuals who do come into our Aging and Disability Resource Center who need services may not want to access them through shelter. And Arlington has a very robust continuum of care. Trina Van is sort of the leader of our Arlington continuum of care. And these are some of the numbers that the continuum of care has shared with us for individuals who are 55 and above, who are accessing shelter, rapid rehousing, and the permanent supportive housing program. For adults 55 to 61, from 2021 to 2022, there was a 3% increase. For adults 62 and above, there was an 8% increase. And then the continuum does have a publication that they released in 2017, or I think 2018. There was a focus on the older adult population. They were looking at the number of older adults in emergency shelters, how many, and many of the older adults who are in shelter have underlying issues that may impact their mental health. And the continuum of care has been working on identifying an early warning system to try prevention before someone needs to access shelter. But one of the things that we see with these numbers do not reflect completely how many individuals in our Aging and Disability Resource Center are requesting shelter. So our Aging and Disability Resource Center that Shandia oversees has seen a steady uptick in the number of individuals who request services, and not just services through the ADRC, but also shelter. We started tracking shelter requests in 2021, and we had 35 that year. In 2022, we had 115. As of May 31st, we've had 175 requests for shelter. That included 31 requests in May. So we are averaging about 15 requests each month. One of the challenges that we are seeing is sometimes when the shelter is at capacity, and we have someone who is asking for shelter, we do try to work with that individual or that household to come up with an alternative plan. But it can be, it is a challenge that the team, we're all working kind of diligently to address. The ADRC also provides emergency financial assistance to try to help people maintain their housing, especially if it's due to an inability to pay rent, but also come up with a longer term plan and solution to remedy the long-term impact. And then our Adult Protective Services team is seeing just an astronomical rise in the number of reports. It's almost double from what we saw in 2022. So as of the end of May, we've had 716 reports to Adult Protective Services. Some of those may be the sheriff calling saying, this person is on the street, come pick her up. Or this person's in the ER, you need to come get her. So we know that, and Shandia will talk about this in just a moment, but the needs of our older adults really require specialized services in supports. Some individuals may not be appropriate for shelter without additional care, some including 24-hour care. Path Forward, one of the housing partners that we work closely with, does have a nurse practitioner. Kasha Shah is amazing. She's truly phenomenal. And Path Forward does have respite beds, which we are very fortunate in Arlington to have a shelter that includes respite beds. But sometimes they can be full, and there's an individual who needs that level of care. The team does spend a significant amount of time assessing individuals for shelter, but also looking at what are the alternatives, what other resources can we look at? And then we're seeing more of the co-occurring needs for services, things that might impact housing, like hoarding issues, serious mental illness, as well as food insecurity. Our current staffing in our Aging Disability Resource Center, we have 4 staff, thanks to some of the ARPA money that Helen was mentioning. We have been able to bring in temporary support, and we have 2 overstrength positions to help with the growing needs. For adult protective services, we've been able to use some of the first federal funding that we've ever received in APS to hire 2 temporary outreach workers. And then our adult services team, we have the 6 staff who provide ongoing case management. And this is especially helpful for individuals who need that ongoing support and sometimes monitoring to prevent them from losing their housing. So I'm just going to share a few quick stories and then turn it over to Shandia to talk about the intake process. But I think it was the same day we had a commission executive committee meeting that we also had back-to-back evictions of 2 older adults. One was a 78-year-old that came in through a next door referral the evening before. And then we had a 68-year-old that morning that the sheriff called and said, "I'm going out in 30 minutes. What can you do to help?" So for the 78-year-old, it was a really heartbreaking situation. She had lost her spouse and was not able to afford her housing on one income. She initially declined to go to shelter, but after some coaxing and convincing, she eventually agreed. The second individual that we worked with, the 68-year-old, she actually had to take whatever she could carry from her home, but her biggest concern was her cat. And we worked so closely with the Animal Welfare League to get the cat into temporary shelter, as well as the individual. We're seeing more complex needs. An 89-year-old was abandoned by her family at the hospital. She didn't have status. And so there was someone who would not qualify for any benefits, but she needed nursing home level of care. So this was somebody who was undocumented and unsheltered, and really required coordination of services to support the individual. And then as Shandia will share, we also have success stories. And so I will turn it over to Shandia to share the next stories.
Thank you, Rachel. So, this is important as it is for us to keep up with the trends of the unfortunate situations that we see come through the door. We do keep very close eye and monitor the successes that we see as well, to be able to see what's working, what's not, what works the best, what could work for needs improvement. So one of the success stories that we included here, one of the clients came to the ADRC, described herself as feeling defeated. And she requested shelter. She needed shelter in addition to mental health services. So staff helped her to complete a general relief application until her Social Security for disability was approved. She did have a shelter stay. She was able to get an ID and to move into her new apartment in May of this year. So she was able to get a lot of that support from staff and as well as staff from Rapid Rehousing. So that was a huge success, because we like to be able to see the follow through from when people come in the door with the need and leave, being able to close the case and seeing that need was actually met. So that's something that we pay attention to. We also track our performance measurement plans. Another example of some of the ongoing support, we did have a client who was out of the country and came back from that country and she had spent several months at Walter Reed Hospital. She was dropped off at a local shelter and then at a hotel in Arlington. So initially she did refuse shelter, but our staff was very persistent with her. There was a lot of coordination with not only the client, but with the different staffing across across states, just to kind of make sure that things were coordinated for her. And in the coordination with her, it was not just as simple as, okay, well, this is the first step, this is the second step. There was a lot of mental health underlying. So there was a lot of persuasion and explaining and clarifying, validating, that type of thing, which did prolong. But it shows how persistent staff needed to be with her to be able to get her on board with the coordinated plan. She did require intense support as a result of that. That was an inability to follow through. And but we were able to at least demonstrate what we would be able to offer her and how we would be able to support her. So yeah, there were some issues with following through and assisting with connections to different benefits and rehousing processes. But that is an example of the ongoing support that is required with a lot of the clients that we see. This is one of the more intense ones because this was an incredible surprise. She wasn't even in the country initially, and then to kind of go through those different stages. So I can talk a little bit about our intake process for the Aging and Disability Resource Center. And throughout speaking, you may hear us use the term houselessness interchangeably with homelessness. The term is often used in different advocacy and policy discussions as an alternative to homelessness. It is person-centered and emphasizes structural and systemic factors that contribute to the issue of homelessness and houselessness. So, as you might imagine, our increased traffic of needs includes a significant amount of shelter requests. And as Rachel had demonstrated before, when she spoke about some of the numbers that we see, referring to shelter is our last resort. Our last resort option. The options counselors collaborate with the clients and they partner with the different programs to research the different housing options that are available. Shelter is the next step if there's no other pathway. So we do try to make sure that we explore everything else before we get to that step. We do make sure that we partner with all types of different programs to research housing options that are available for the clients. So that might include clinical care coordination, managing different referral processes, determining eligibility criteria, being an Arlington resident. And that would mean having a lease or having had a lease that's at least 90 days old, a letter from outreach teams like TOE, stating that they've been working with the client for at least 90 days, something like that to establish residency. And there could be a notarized shelter and residence expense verification form that verifies that the client has stayed at Arlington at an Arlington address for at least 90 days. So that's also something that we can consider for residency verification. Basically, 90 is the magic number. There is a verification of sex offender status. Offenders cannot be placed at family shelters. This is relevant to older adults because there's no separate shelter option for older adults. Which is an issue that we've seen come up more and more in a need. It's something that's transformed into a major need. We do ask for documentation. We need a copy of the ID, an Arlington service application that's completed, release of authorization to be able to share coordinated information with the shelters, and a brief triage form. The ADRC team does email those referral documents to the Economic Independence Division that Helen referred to earlier in our part of the staff update. They do process the shelter referrals on Mondays and Thursdays. The primary contact then takes those cases that need priority, that are prioritized, and the referring worker or the case manager is the client's point of contact. They are notified when there is shelter availability. And so considering that we engage with a variety of complex barriers, more often than not, options counselors on my team tend to spend about 1.5 to 2 hours on the intakes. Every now and then the range on the shorter end would be about half an hour or 30 minutes, but with the complexity and the increased numbers we're seeing, we tend to spend more like 1.5 to 2 hours with clients with these types of needs. So to kind of segue into barriers here, the barriers that contribute to the different complications of the shelter referral process do include clients who present with the most basic of Maslow's hierarchy of needs, along with severe mental illness. For example, paranoia. It can be difficult to get information from clients that we need to be able to help them if they're struggling with that particular symptom. And it can prolong the intake process as well as access to services. And especially if it's untreated. It does prevent a lot of the follow through that we need. There are barriers that exist in the form of distorted expectations. So we may have people thinking that they come into the ADRC and it's at 4, they come in at 4:30 and that they will be placed in shelter by 5 p.m. that day. Given the different barriers that we've seen to accessing shelters with no room and no specific set aside for older adults, that's very unlikely, but that is an expectation that we see often. And so there is an additional layer of explanation and empathizing with people who have the need, but that we cannot promise that within a 30-minute window you will be placed. There's also the expectation of sometimes, calling. We have the shelter request and then the extensive calling throughout the day, that being fueled by anxiety, being driven by, what the need is, which is understandable, but the consistent calling and it just kind of falls into the high volume of calls that we already do receive for additional needs as well. It just gives a good picture into the way that clients, that their needs are also driven by further anxiety and the unknown. And then there's also sometimes the expectation that they will just be placed in a hotel, which is not always likely, but it is something that we have run into often where clients will call and simply express their distaste for shelter. Understandable, but and so therefore, I'd like to know what hotel I'll be at and when you'll come and take me there. So, we have a variety of distorted expectations that do come through the door that accompany the need when we have people coming into the ADRC. Some of the other barriers include residency problems, like Rachel spoke to earlier, especially with our undocumented demographic, people coming from surrounding counties or even other states as far away as California. We have had that quite a few times. Right now, we're working with someone who recently, that was the example that I gave. We're sort of finalizing and closing the loop with the women that actually came from the different countries. So we do see a lot of traffic. It's worth noting that when we do get these calls from surrounding counties or surrounding states or not so close surrounding states, that it speaks to the reputation that Arlington does have, even in the shelter realm, that older adults will come from wherever they are and make their way to get here because they have heard or they understand about how wonderful Arlington County can be for older adults. That is something that I do think needs to be noted. It needs to be highlighted because it is something that happens frequently enough to, raise curiosity about and try to understand what's the driving factor there. So I do need to make sure that I point that out. Environmental appropriateness for older adults who are not accommodating for people with specific ambulatory or medical needs, excuse me, I'm so sorry, is another barrier. As well as some cross-program procedures, rapid rehousing, sometimes placing older adults in housing that already exceeds their income, and it results in a cycle of temporary fixes and subsequent houselessness after that. So considering that we meet these barriers more often than not, like I mentioned earlier, we do tend to spend a lot more time with people when it comes to intake to try to get through these issues. So in terms of the continuum of care model, I struggle with that word. You can see that the problem is increasing rapidly. While continuums in general usually demonstrates pretty slow change over time, this problem is advancing pretty quickly. So ideally, our efforts need to match the pace of the problem a little bit more closely. So you can see from the diagram, you start with proactive prevention, and that can look like diversion, working with the individual and stakeholders to actively prevent the eviction or the displacement. And that can include financial assistance, the community living program, deep cleanings, rapid rehousing, case management, and mental health assistance. You can see next the shelter screenings, our program, the ADRC screens for the intake for shelter, makes the referral to the appropriate environment, engages with adult protective services when it's necessary as well. In terms of the shelter placement, you can see that placement in Arlington shelters are exploring non-jurisdictional shelter placement, case management, coordinating with the shelter, exploring the different housing options that are available, identifying unmet needs, for example, having an ID, any documentation barriers that might come up, social security, things like that. And then rehousing. So being able to provide stable housing, connecting with individuals who have long-term supports, who need long-term supports, and services to maintain their housing, like adult services and the community living program, nursing case management, permanent supportive housing, and a variety of the CSV programs as well. There we go. So in terms of building capacity, so we do have a need. Actually, before I make this point, I'd like to say something else that kind of stands out that I'd like to just people to kind of get some thought to. This demographic is often overlooked, as we all know too well, and it's left out of larger conversations that takes power. So it's exposed to additional vulnerability and marginalization. And this is an urgent matter considering the racial equity push that Rachel spoke to before that we're marketing as a main priority. We do see a lot of discouragement in people that come through the door when considerations of older adults are not considered, especially for shelter placement. And regarding those instances of medical needs or ambulatory circumstances, the capacity to handle those internalized environmental stressors, things like that. So everything that we're sharing today does directly impact the lifespan experience of individuals, particularly in what one of a behavioral theorist, Eric Erickson, described as integrity versus despair. And so that's a psychosocial development theory in which around the age of 65, one begins to reflect on their life. And it's really important because as this is happening, there is a general happening of feeling as if you have developed integrity in this sense, or if you're in a place of despair when you're doing this. This can be extremely exacerbated one way or the other, depending on situations like this. If your basic needs are not met, if housing is not something that's stable for you, it can really put a strong push in the direction of despair. And that's something that impacts not only quality of life, but the duration as well. So this is a bigger issue that needs to be taken very seriously by everyone. So I do appreciate the advocacy and the attention here today for that. I just wanted to make sure that I put that out there for thought because it is a bigger issue than houselessness, which is large in itself. But this does impact quality of life and duration as well. Okay. So to kind of pivot toward what it could look like for us to attack that issue, staffing needs and in terms of building capacity, there's a need for additional staff positions that can address needs and alleviate caseloads to the pre-pandemic level. The two overstrength positions, if we could get those to become full-time positions, permanent positions in the ADRC, that would be very helpful. An additional adult protective services clinician, dedicating staff through the Aging and Disability Resource Center as an older adult homeless specialist in order to focus on clients and households who experience homelessness and those who are transitioning out of homelessness or houselessness. Hiring a dedicated Department of Human Services eviction prevention coordinator as well could be really helpful in this sense and would be appropriate at this point, given the volume that we're seeing. In terms of partnerships and stakeholders, partnering with the continuum of care, increasing capacity of the continuum of care to serve older adults, the representation of older adults in the Arlington continuum of care that Rachel spoke to earlier, which is something that can certainly, it does have room for improvement. Proactively approaching the prevention of homelessness and houselessness among higher risk populations, keeping thoughts around the racial equity lens as well with that. Further training and advocacy as well could be extremely helpful here. No problem. When we look at assessing the future needs, requesting a study of the current issues and the needs of the special populations that we see and we serve, older adults, persons with disabilities, people who are undocumented. Evaluating those current needs for overflow, planning for expansion, adding a dedicated home health or certified nurses aide to shelters, New Hope shelters, the HSC shelters, and exploration of development of community care homes, the greenhouse model, for example, like what we talked about at the forum. So these are different, ways that we can approach assessing needs of the future as well.
And that photo is from an individual who was evicted the week of Christmas. We got a call from the sheriff's office just saying she has no way to get to the shelter. It was 3 days before Christmas. That was her life on the street. Come pick her up. So, this is what we're seeing. And we just want to close in sharing the story, not from us, but from someone who lived through this and was comfortable to share her story with AARP. And
I need to share this side too, right? So
Yes.
to unshare and reshare. Yes.
Okay.
Yeah, okay, sorry.
But AARP has begun to spotlight this issue as well, and we can share after the meeting as follow-up, some of the links that they have shared in the videos of individuals with lived experiences. And we're about to hear from Gina, who is an Arlington resident. And if not, we'll share it, after the meeting.
It's not turning the computer side up, so.
So for everybody in the room, thank you for suffering through the technology issues that have been constant. It doesn't seem like it's happening for anyone online, which is good, but the screens in the auditorium continue to refresh themselves. It seems like every 3 seconds.
Yeah. So it's not gonna share the sound over the hour. It's the issue with the integration. of the
Okay,
hour. So, yeah.
we'll share that after the presentation. But again, as Shindy has said, thank you for the opportunity to spotlight this issue. We'll be happy to share the slides afterwards. And then if anyone is interested in learning more, Audrey and the Housing Committee is really helping to focus on this issue. So please look at that. And then the continuum of care, we can share the schedule for those meetings, but it would be nice to have more representation. And I don't know if Marta is on this meeting, but Marta has started to attend some of the meetings from Culpeper Garden. So at least helping to share some of the experiences that older adults are having throughout the continuum. And staff, we've been attending some of them. We've started to attend some of those meetings as well. Oh, there's Marta.
I'm attending, Rachel, so thank you.
Thank you.
There are a lot of people, older adults living in their cars. I know there's one in my neighborhood who I've seen, but is that a phenomenon that we're seeing quite a bit of? Is that increasing across the county? And I wondered if they have safe places in which they can park their car. I'm sure that's a concern too.
So we know a few of the individuals who are living in their vehicles. And we do try to connect them with services and offer resources, but for many individuals who are their own decision makers, they can refuse those services. And but we do know of a few who are living in their vehicle that we'd love to connect to services so that they are not. But I do know, we know of that individual for sure.
We're keeping our eye on that too, because of we do keep our fingers on the pulse for them and just make sure that we actively engage, especially if they do have needs, like Rachel mentioned, if they are like, no, I'm actually a little bit more comfortable here, but just letting, as long as we let people know that we are completely open for any support or any additional support that they're open to. That's something that thankfully that demographic is smaller than the masses we see asking for shelter. But we are keeping our eye on it.
So I'm gonna Jim and then Regina. So Jim first.
Yes, as we roll off of COVID, what are the influences of COVID, the COVID period on this? We've lost some funding. We've probably gained some victims. How does that work out?
Yeah, I think some of the protections that existed during COVID, so the eviction moratorium, in many of the, especially multi-family housing units, there were not inspections that took place. So you didn't have people coming into your home always, which for individuals who may experience characteristics of hoarding, having that extra time allowed accumulating more stuff. But I think a lot of the protections that we saw during COVID, we're now seeing the impact of that. So the eviction docket for the Arlington courts, and we work closely with legal services in Northern Virginia. And I don't know if she's on here, but Dr. Heather Benner is a great advocate in our Economic Independence Division in helping to access those kind of resources of the eviction docket, of additional emergency financial assistance through the county board. But we've seen a significant increase, and it is a very constant flow of the individuals who are in need of housing, those who are losing housing. And it seems as soon as you kind of help the biggest crisis, a bigger one shows up. And so it's also, I think, at the advocacy level of the need for more affordable housing. And we know that there are going to be additional housing options and apartments for older adults. But I think as we look at the waiting list for many of our independent living residences, like Culpeper Garden, like Woodland Hill, Claridge House, they're years long. So it's also demonstrating to us that there's not enough housing. Right.
Regina.
I'm just curious about the trends that you might be seeing in older adults that are also serve as caretakers, whether it's family members, spouses, children, and when it comes down to being unhoused and in terms of linking them to access to resources, like what does that look like? Are there any upticks in the trends? Like, what does that look like for folks that are serving as caretakers?
Yeah, no, that's a great question. And Regina, would you like to introduce yourself?
My name is Regina Chambers, and I am the Senior Racial Equity Management Analyst for the Housing Assistance Bureau. So I'm happy to be here with everybody.
No, thank you. And great question. So I think we're also seeing the impact of caregiving on housing, but really caregiving burden. And just last week, we had two different caregivers. One individual she just brought her mom to live in Arlington with her, and she has an adult sister with mental health issues. And so just looking at, she's overwhelmed and trying to find services and supports for both her mom and her sister. And so we talked about a few different resources that could be available, but then even just mentioned her needs as well, and just the burden the caregivers are facing. Our adult day program does have a caregiver specialist who is trying to support individuals in those situations. But the second situation that we had was someone who just relocated their grandma from Wisconsin. And it's not working out. And so basically calling to say, I made a mistake, you need to come resolve this. And so, and the same thing I think with the 89-year-old is that her needs became so great. The family said, I'm done. She's at the hospital, she's yours. And so, trying to work with caregivers that first there is support, let us help you, let us bring in-home services in, adult protective services can help. We always try to use the least restrictive intervention, but also recognizing that caregiver stress and caregiver burden is a lot. And I think we're just sort of at the tip of the iceberg with a lot of what we're going to see of how that impacts housing in the future.
I think it's just, I get the question that came to mind as I was thinking as the presentation was going on. That folks that now, older adults that are serving as caretakers, especially whether it be grandparents, whether it be, you know, caring for a spouse, a partner, and also facing possible houselessness. That's just, and now that we're at that point where, you know, COVID restrictions have now, you know, lapsed and we are in this quote unquote post-COVID era. What is that, you know, going to look like for people who are also in that population but serving as caretakers?
Right, right. And that's a great point because caregiving does have an impact on earnings,
Yeah.
on your work schedule. Not everyone gets leave with that. And then we also see sort of that in-between generation of you're caring for an adult or, you know, a parent or an older sibling, but you also have children you're caring for. And so just being stretched in so many different directions. But that's a great point. Thank you for mentioning that.
And Jan, actually to add to that, I'm glad that you brought that up because I know that we can see that with certain racial groups, that's a little bit more prominent, you know, than others. And so I'm glad that you brought it up. That is something that I wonder, we don't see as much of it now, of that demographic now, but typically that could be because with bigger families, there tends to be a little bit more support for now. But over time, you know, there is the caregiver burden, compassion fatigue some. And so I do wonder over time with the moratorium having folded back, what type of remnants are we gonna see from that, especially with that demographic? So
And then it's like also too, I mean, I was thinking about two specific situations where there were parents that lost children during COVID, and they also had to step in as caretakers for their grandchildren, right?
yes.
And that was a heavy burden to have to pick, you know, to take on, not necessarily having resources or support. And also too, what does housing look like from going from like, I'm a single adult living in, you know, maybe a 1 or 2 bedroom. Now I've got to go and find other accommodations, larger accommodations for my grandchildren. And that's causing more costs, you know, so all these different things down that we're trying, you know, starting to see, I think in the last couple of years.
Yeah. No, thank you for raising that point. Yeah.
Me or her?
Go ahead.
I was just wondering, it was interesting as I was watching these slides, you were always using the female pronoun, both your success stories as well as your stories that. What is the ratio of the number of women that you help, older women as opposed to older men?
Oh, good question.
Very good question.
We have to get back to you.
Yeah.
Yeah. We do have some men's stories too. Yes. I was gonna say, if Patty Nance was supposed to be here as well. She's one of our licensed clinical social workers in the adult services unit, but yes, we do serve men, women, non-binary, anyone. I think we actually have one individual who was transgender, who identified as transgender. But we can get that information for you.
I just thought it was interesting that your pictures always were of an older man who was looks homeless, but yet all of your stories are about older women.
We can throw a quick man, no, Patty was gonna tell a story of a gentleman who, his sister had passed away and they've been living in a home they rented for almost 50 years. And the homeowner he was older, he was gonna sell and, move to the Caribbean was his plan. And so the individual, by the time we got there, again, the sheriff was going out to serve the eviction. He was actively suicidal. And so Patty went out, she met with him. We were able to coordinate something for some of his belongings. But he had his note and he gave her his note that he was ready to end his life. She was able to convince him to go through shelter, connected him to permanent supportive housing. And I got to see him, I think, 2 months ago in his new apartment, and he is thriving. He's doing really
Another
well.
success story.
But yes, we just, so we do have the success stories. I think we wanted to show a picture of some of the complexities. But we can get more stats. And then, both the region, published a point in time study that we can share. And then Arlington's Continuum of Care recently published the action plan for ending homelessness, which is also on the county's website. And there is some information for the totals, I think the breakout of gender, of race and gender. But we can get that for our older adults as well.
I mean, I think the other thing is just to keep in mind always that, at least particularly in that generation, the socioeconomic status, you know, once if a woman never married or loses her spouse, has no savings, is totally on social security, it's not surprising, but it's just kind of interesting that that's who your population is right now, our population.
Even women who have worked.
I'm sorry?
Even women who have worked in
Big time.
that earlier era before RISA
Yeah.
required.
No savings, no kind of, you know, savings plan or anything like that, so.
I really encourage you to watch the, when we do share the county board meeting in which Mr. Blaze is recognized, to take a look and to hear a description of the case. One of the cases that he was specifically recognized for was a perfect example of that. Having lost a spouse and really losing her sense of self and not having that safety net and not having anywhere to turn. And then that layer of just totally compromised functioning due to that loss because of the depth of the grief. Because that is a very real issue that we're seeing.
Sure.
Yeah, but women tend to live longer.
And that's it.
Right, too. Right,
Right, so they need the services for a longer period of time, and if they get
at an older age.
thrown out of their.
Right, always, that's right.
And they also may seek care.
Yeah,
More
they
than
will,
that.
yes, exactly, or be a
Yeah.
little bit more descriptive, or more willing to share, that is
Yeah.
something that is characteristic, so,
Yeah.
yeah.
I just wanted to mention that, kind of nationally, we're seeing a trend in senior centers trying to help homeless individuals. We were in LA where homelessness is rampant. I mean, it's just so sad. Many older adults, people are on the street, everywhere, every community within the LA County area. But we visited a senior center there that, takes in homeless people during the day, so that at least they get a hot meal through the congregate meal program, they get access to services and programs. And they also use their parking lot as a safe place for older adults in their cars to sleep during the night.
Oh, that's interesting.
Yeah,
That's really
yeah.
interesting. Do you have any more information to share on that?
Sure,
Yeah, I
yeah.
think
It's
that's
called One Gen. It's in the Valley in LA. And a wonderful senior center, intergenerational too. They do a lot of work with a local high school next door. But I wanted to ask Jim, you mentioned that NBAN is working on some things right now related to unhoused older adults.
Yes.
Can you share anything more about, is there a piece of legislation that's been introduced or?
Yeah, one of the NVAN priorities is to address eviction. But it only addresses it from the standpoint of time. It's trying to add another 10 days to people who are being evicted because they can't come up with their rent money. And I think Rachel suggested that's a problem for a lot of people, including people who are on social security.
Yeah. Okay.
So it's not an overwhelming solution
Yeah.
to the problem.
Yeah. Good to have,
So-
yeah.
Is there any, some of these issues are so complicated. I'm aware of what y'all have done for a family friend that I know of. Are there resources to help with some of the navigation? I mean, the person I'm thinking of didn't, not necessarily have mental health issues, she had physical health issues. And the change because she got affordable care was unbelievable. But to do that, a friend of theirs literally took days off of work to help navigate, not to mention all the work that the county did. So are there any tools that are help with pieces of the puzzle in terms of volunteer activity? Are, strengthening the resident services liaisons? I know some properties don't even have them, which is criminal, I think, a shame not to take advantage of that resource. But something to help you all along, maybe not with this whole package, but maybe a part of it that they could help relieve that burden.
I definitely think the team trained as options counselors, for the adults 16 and above. But I think the other thing to consider is that for someone who may have had a life of chronic homelessness, that chronological age, could be very different. And so I think for us, I mean, we do have our trained options counselors. I know some of the housing partners may have, case managers, or I think one actually hired a navigator recently. But I think there's more opportunity for training and in cross training. And we work so closely with economic independence and Heather Venner and Jenna Adams and their teams. But this could be an opportunity even for the ambassador program of looking at maybe not the full on deep dive of, do a shelter referral. But I think so much of it is connecting people to resources. And for Culpeper Garden, we have a very close relationship with Culpeper Garden, but a number of the new residents over the last probably year, 2 years have had a history of homelessness.
Right.
And so there is that need for ongoing case management and support of how do you pay your rent? Pay your rent on time. The prioritization of some of those things, of being, good neighbors and those types of things. But just that ongoing support, I think the training for resident services, counselors and coordinators is important. We do have some trainings around dementia friends, overview of aging disability resources, and then just the different services that we can provide. And then I don't know if Wendy is on, but Arlington Neighborhood Village has been a tremendous partner as well in that socialization piece, because especially with our older adults who live alone, isolation can kind of feed into many of the things that Shandy has shared, and contribute to higher rates of paranoia, of depression, of anxiety, and how that can be expressed. And so sometimes it's just having a friend. People who might call 911 over and over and over and over. Their intervention may be having a neighbor who's willing to, go out to lunch together. And we just had that situation recently of, connecting neighbors has been really helpful in reducing some of that burden. So I think it's definitely a community-based approach, but we really have to start with naming it. And then engaging with our older adults who are experiencing this and being able to offer more specialized service to them.
Charlie, did you have a question?
Yes, thank you for this valuable insight information. It's very helpful. In other work that I do, I know that in many places, guardianship is overused in terms of making decisions and finding placements for people who have some level of cognitive impairment and crises such as homelessness. And I figure you don't have any data on this, but I'm just wondering how often do you have to refer cases to the county for possible guardianship petitions?
We can probably, trying to think, so we could probably get that information. We can follow up with some of that information, but it's not as common but we do have individuals who have been in shelter that we've requested a capacity assessment, or if somebody is in the hospital, before discharge, that there is a psychiatric assessment that happens prior to discharge. But we can get the information for you on something like that. I'm thinking of a recent example of another woman, but she was about to lose her condo, and a conservator was appointed because of some of the financial issues, but not a guardian. But we can get that information and then follow up about the gender as well.
Are you still involved?
Interesting articles.
Are you still involved with those cases once the
Yes.
guardian or conservator is appointed? You are, okay, great.
Typically, it will depend on the situation and what the longer term plan might be. If there are resources, and we can see this occasionally as well, of somebody who was living in a home that, maybe a parent owned, the parent passed away, they weren't able to continue the upkeep on the home. They go to shelter, then once the home sells, they have access to resources. A guardian may get involved, but if there are resources involved and they're able to access like long-term care, we may not follow that case beyond them being in that safe long-term situation. But for the individual with the conservator, yes, there's still a lot of moving pieces with that case. But we can maybe look at getting some data for you on that. Yeah.
Thank you.
Okay, and then last comment on this, Wendy.
Yeah, Rachel, Rachel and Helen, thanks. I just wanted to do a little bit of an add-on to this. One of the things we might think about is a better you guys may have a better method to reaching out to property managers. In the last week, we had two people, both who fell in their apartments, and we learned about it because a volunteer was trying to reach them. One had a medical appointment, the volunteer was just doing, as you said, Rachel, follow up to talk to the person to stay socially connected. It turned out both had fallen in their places, couldn't do anything. In one instance, the police were called to have to break down the door. In the other instance, after the property manager said, yes, we have keys to that apartment, but we can't go in, we can't go in, we can't go in. Finally, a resident in that apartment said, damn it, give me the key, I'll go in. But in both instances, the property manager had keys to the apartment, but felt they didn't have the ability to go and unlock the door and check. So I just think that there's more conversations we can be having with large developers, large and small developers, about steps that we can all take. I'm just sharing stories so that we can all think about solutions and conversations that we're all having.
Yeah, no, that's a great point, Wendy. And I know before COVID, we actually did work closely with the fire department in that specific community. So we did a presentation. I'm thinking Hunter's Park comes to mind. But we actually invited the fire department from that neighborhood to come out. I think we had the police there. Or who else we had there at that presentation. But one of the things that came out was some of the residents were afraid to open the door. And I think some of this cultural factors can be an issue there. And so being able to meet with the fire department to talk about the resources, but that could be something, we think about doing. And then I know Life Alert is a great resource through VHC. And then with Marymount, the falls prevention program. So it sounds like you covered quite a bit there, Wendy. Well, thank you so much.
Thank you. Thank you. Thank you. More dramatic than I even imagined.
There is, if you want, an uplifting article in the New York Times yesterday on homelessness and the new law they have where the police have the authority to pick up and forcibly put somebody who has mental illness who's homeless into a hospital. And they have the capacity now to handle them, and they can keep them until they have their psychosis or whatever under control. And then they move them into apartments and manage them.
Mm-hmm.
And they have some, it's a pretty draconian approach, but they have some interesting success stories. I'll send you them.
Yeah, you can share with
You thank you. That would be great.
And that move was incidentally generated partially by an article in the New Yorker that showed problems of trying to get people into the hospital who are homeless and waving, and finding them back on the street in 15 minutes. The hospital won't keep them, so, yeah, that's a major problem.
Mhm. Or they end up in jail
Yeah.
with mental illness, and that's the solution for them, and that's not the right solution. Yeah.
Thank you. What to say, it's pretty heavy duty coming back from vacation. I'm sorry to be late, please forgive me. A little bit off time. I think this was pretty wonderful and really appreciate the work going into it as well as what you all do every day. And I just think that's pretty amazing. Curiously, on my trip, as a quick aside, I ran into Dave Leepson, who's like the godfather of the 10-year plan to end homelessness. He was headed to Alaska as well, so I don't know, and on another trip, so I'm hoping I can find him and see how he's doing. I appreciate staff going through their reports in my absence, and I guess if we want to, we can move on to. That'd be appropriate. Anybody have anything else they want to say before I charge in with this sort of thing? Okay, may I have a motion to,
So moved.
So
okay, second. All right,
I have,
hold on 1 second. Yeah.
I have for the positive aging. What was written is right. There are several points that were missing.
Okay.
You have a copy there. Do you want me to read it?
No, I don't think it's necessary. Well, I don't think it's necessary to read it. Link has asked for some additional content to be added to his report.
Okay,
And provided the notes of what he would like to have added. So we can read it if you want to hear it.
Now, I just think the minutes ought to include
Include.
factual things.
Yeah.
all right. Does anyone care to have what Link submitted to be added read aloud? Kathy,
I have another question about the minutes.
all right, let's resolve that question first. And I think what Link is offering here is a greater expansion on the details of what PAIDC has been doing in the area.
And that's something that was talked about at the meeting.
Right.
Yes.
Are you all good with, all right, may I have a motion to approve the addition of the PAIC?
So,
Thank you.
second.
All right, all in favor? Okay, so we'll add that to the minutes. Kathy, you have something.
I was unclear on kind of what the next steps are for the, the presentation that was made on technology, internet access, technology access, et cetera. They presented the study, but did we refresh my memory if we talked about what happens now, right? And how can the commission become involved in any next steps for?
I think I will defer to you. I similarly felt that we were partway through a process and that they had not gotten to the point of a finite list of recommendations and steps to move forward, but maybe I'm wrong. Link, do you have any thoughts of what Holly spoke about at the meeting?
Yeah, she basically talked about the status of a multi-phase, rather long-term, contract evaluating and recommendations. They are moving ahead with deliberate speed, addressing as much of the issues as possible.
So it was pretty much a status update then?
Yes. But what I got out of it is that they're doing their homework at the same time of adding many of the things that we've all been looking for. And that is high-speed connections for everybody. There's a lot of roadblocks or a lot of challenges, and the study documents those and recommendations to overcome. I heard nothing that said that they were not going to achieve the same objectives that we're looking for.
It's, but I don't think I recall the timetable either. I think we're midway in toward the end of their report and recommendations. Is that, or do you have a better sense of that?
No, we can follow.
Okay, yeah, that'd be a good question to follow up on.
Yeah.
And let us know.
That should be like every 6 months we revisit.
Okay, any other questions? All right, may I have, let's see, vote to approve the minutes as amended. All in favor, say aye.
Aye.
Anyone opposed? Anyone abstain? Hearing none, the minutes are approved as amended. Well, is William with us to provide the chair's report?
He is not.
He is not.
He
Well,
is not.
I guess we'll just move along then. My report is that I had a great time in Alaska. And it was really interesting. I didn't meet many older adults, except for all those on our boat, but, our cruise, but all went well. All right, and you have accomplished the staff report. Yeah. Right, then it's time to move into working group updates. And does anyone need a break? Do you want to just keep on moving?
I'm going to leave him alone.
All right, Cynthia is not here to provide the age-friendly, I'm sorry, let's do that committee reports first. Beg your pardon, Audrey.
We've had a lot on housing, so I'm gonna just make one comment. I went to the SPRC meeting last week on South Sunrise, leave assisted living. And the upside was that there were 5 or 6 people who were all pushing for affordable assisted living units. The downside is that it doesn't look all that promising. They're trying to figure out how to make the finances work. I don't know if there's anybody in the county who can work with them to help them understand what auxiliary grants would get them, or, you know, what the gap would be between what people would typically be able to afford, because I think they're looking now at having to fill that whole gap. But best case scenario, I think they'll provide 1 unit. They're still talking about just 1 whole unit and none in North Glebe.
To start.
Well, I think it's still 50-50.
Yeah.
But I think if we can give them some help to understand what their burden would be on a continuing basis. They did make the comment, there really isn't any policy in Arlington County about how to handle assisted living units versus regular housing units. And they are not requesting additional bonus density, so they're not as obligated. And so, but that's where I'm at with that.
So you raised some very interesting questions, and I don't doubt their pushback, but I do believe that in Alexandria, there was not a fixed policy either. Is that correct? It was done by arm twisting.
Well, they got a lot of arm twisting that night,
Good.
but I don't think it moved them.
So what is the next step?
They're gonna come back to the planning commission with a decision. There was no additional next step.
And then,
And I don't know what we can do, but I'm bringing it up in hopes that we can do something.
And we can look at inviting staff from community planning, housing development, from CPHD, maybe to come to the July meeting to provide an update.
and what I'd like to know is what we have to do to change that policy. Because nothing is going, we can arm twist, and I was hoping we could use Alexandria for leverage. And it is important to have more affordable, more older adult options in Arlington County, and I think that's wonderful.
Yeah, I mean, we know that Richard has been looking at this, Richard Tucker at CPHD, and so having him come in July, I think would be beneficial.
I also think that some of the data points that you have raised here, if he hasn't seen that, that would be important.
Yep.
The lawyer representing Sunrise is a very familiar face to affordable housing development in Arlington. And maybe he'd like to see a copy of this report. I'd be happy to do a letter over that and send it to Kendrick Whitmore. Yeah, so I think some of those kinds of things might be helpful. Or to sit down with them and ask them, what are the options? You know, there is, for better or worse, there is the concept of transferring density or transferring funds to support someone elsewhere if you don't want to support them at Sunrise. So
If they haven't asked for additional density, what is their requirement?
not, right now, not.
Right now, not.
Okay, so,
Yeah.
so
This
it's a lot of arm twisting.
It is a lot of arm twisting, right? So I guess the other question then is, and we don't have a liaison, but I think this report should go to Katie Crystal as well for the last few weeks. Is she still here or is she gone now?
So last week, you know, this is her last week.
Yeah, it's okay. We can still send it to her. And I'd be happy to send it over my signature if you think that's important and send it to Matt as well. When we had, when we had all the candidates who were considering, or running for the Democratic, opportunity to run in the general election for the county board, they all said they supported affordable assisted living. So let's hold their little feet to the fire.
But, yeah, but I mean, either the county has to put up
Oh, yeah.
money or they have want some favor.
Well, why can't they? I mean, why can't they put up some money? Why can't some of the AHIP funding go to support the development of affordable assisted living? Why is that unlikely?
You're asking for a contribution. I mean, I
Right.
guess.
Right.
And, you know, some firms are, I mean, when Amazon contributes, it's because they think they have to maintain, they may have wonderful things in their heart, but they also feel they have to maintain goodwill with Arlington because they may want to ask for things and they have a long.
Sunrise is asking.
So maybe if some, you know,
They've asked for a glove, change in North Arlington in a property that's not been 100% subscribed in a residential neighborhood. So yes, they are asking. So I don't see any reason. Doesn't hurt. Anyway, so
I've never run a business, so
Audrey, it should come through you, but whatever I can do to be pushy, I'm happy to do.
Okay, I'm leaving for Germany in a week.
Okay, so we should talk. Yeah.
We need to,
Okay. Yes, I know you are, and that's wonderful. Okay. But, and you have such a heavy lift, and it doesn't look like it's gonna get any lighter. So, whatever we can do to help you, and we'll maybe talk for a few minutes afterwards.
Okay.
Perfect. Any other thing you wanted to bring up?
there is a housing study in Arlington that's been going on for a while. They did do a focus group for older adults. There is an opportunity to provide comment. It's home ownership study, just on land home ownership. That does affect a lot of older adults. There's a home ownership study. And there's online visioning feedback that closes July 7th. And I don't know how to get that out to, the link out to everyone, but it would be
Send
helpful.
it to me and I'll include it with the follow-up.
And there's a meeting in July.
There's 2 meetings in July. One exploring a home ownership subcommittee working session, which I won't be at, because I'll be away, and then July 22nd, community workshop, home ownership vision, goals and objectives. Community members are invited. So it would be great to have 1 or 2 people from the commission. And I'm also going to check with the committee If you're interested in home ownership and all the issues related to older adults. Helen will send out that one.
And they are really trying hard to get feedback, so if we can get it out to the older adult community for feedback, I ran into Kyria Brown, who's heading that, on Saturday. And, they were actively trying to get people to fill out the study. So if you have a few minutes afterwards, and I can help with backing you up. Got you, I don't want to step on the toes of your own. I feel touched. You can tell I have attitude about this. All right, and it's pretty obvious. Thank you for all you do. So are you going to be are we allowed to ask, are you going to be in Germany for a little while? Is this vacation?
3 weeks. I have a friend who moved there last year. And I told her I'd come visit.
Nice.
So her mother and I are flying out on the 5th. Her mother's flying in from California on the 2nd. So the 3 days before I leave, I'm having company, which is freaking me out. And then I'll be there with them for 2 weeks and then in Berlin for.
Nice, lovely, glad, hope you have wonderful.
But it really takes up my July.
Yeah, sure does. Sure does. Well,
So I won't be here at the next meeting. So if you want to move the housing to September.
oh, okay. Well, if we were gonna have, can we talk about that for a few minutes? So I think that would be appropriate. Yeah, I really would feel more comfortable if you were here also. Do you know what you were going to focus on for your housing, and would CPHD coming in July would that be a good thing as a setup for you, or would that be a bad thing because we're doing too much housing?
I'd like to be here to hear them.
Right.
But
what were you planning to do for your housing focus?
My housing focus and
In July.
that's today.
Oh, I'm sorry.
July is the ambassador program. Oh, that's right.
All right.
No, we were just singing Richard Tucker for a brief update on the affordability of assisted living.
And you want to be here for that. And so July might not be the best
Oh,
time.
that's September. Yeah, we can have them come in September.
Okay, does that make more sense? Okay.
And then just quickly, Casey, and thank you, Casey is, she put in the chat, she's with the continuum of care as well with housing. But she put the Arlington's homeless continuum of care strategic plan to end and prevent homelessness. Their draft feedback session, she included the link, so we can also send that as a follow-up.
That'd be great.
In addition to the homeowner helps. Okay.
That I've sucked all the air out of the room.
Well, we'll let Herschel, can you fill us in on legislative, anything happening?
Well, the people are working on the, and then 2024 proposals first to get sort of the exact wording for grip card that's kind of, I guess, the elevator pitch for the items, and then over the summer, the background papers.
Do we have just the basic things without the background papers? Sorry, I'm kind of out of touch with that.
Well, when I sent it out to the committee, Terry castigated me
Oh,
for having done that because the exact wording
has not
had
been,
not been
okay.
completed. So rather than send a follow-up to the people telling me not to say anything, which would have underscored, I just have let it drop. A number of people from Arlington are participating. And if anybody thinks they might want to participate over the summer, process, they should let me know what Terry is. there's a subgroup of which Joan and I and William are participating to contact new potential new delegates and senators and tell them about NBAN, about the NBAN as a resource, about the annual platform and about the breakfast. And trying to get them to the September breakfast. I guess that Joan, you think of anything else?
No, other than to say at the July NBAN meeting, the bullets for the priorities will be approved. And that's why things are not out in public yet.
That's sort of the other thing, if there's anybody here who we haven't spoken to before about NBAN, let me know, and then we'll tell them about the July meeting, which all the meetings are now, and probably forever will be in Zoom. Now the people from Prince William and South Alexandria don't have to drive to get to the meeting.
It is pretty wonderful.
People kind of like it the way it is. So I think it'll be permanently on Zoom.
Okay. Anything else?
No.
Thank you. Any questions for Herschel before we move on? Right, long-term care residences, do we have an update?
Yeah, we do. And I don't think Mamuna is on, but we did, meet 2 weeks ago, I think, to go back to my notes of what we talked about. We had some updates, from public health that we extended our appreciation to Maria. She is kind of rolling off, and, COVID is now considered a communicable disease. And, Lisa will be the new kind of liaison to the long-term care committee. We also shared an update on one of our nursing homes who was planning to discharge 10 residents. So we're continuing to actively monitor that situation. And all of the residents are open either to adult services or adult protective services. We have the ombudsman involved as well as state licensing that discharging somebody from a nursing home to a shelter is not appropriate, but actively working with that particular community and those 10 residents. But I think those were the big updates. And then Culpeper Garden has a new administrator in the assisted living side.
Okay, thank you. Any questions or any updates from those who are liaisons that we didn't cover? Right. Moving on to positive aging, inclusion and enrichment.
I have 3 things to report. A new member reported for duty and started running hard is Roland Watkins here.
Great.
He's full of ideas and recommendations that we'll be implementing.
Great.
Number 2, our meetings, while adjusting our basic missions, have been more of a I call it a strategic thinking group. Worrying about the environment that is changing around us, impacting older adults perhaps harder than any other, besides the less affluent. We've been working on thinking holistically about how to help not only the communication and involvement that we've long had. You'll see some recommendations in that regard as we firm up our brainstorming. I have a report from Andrea Walker on the walking school bus. Yes, I've been on the kitchen cabinet since before its existence. The report is walking school bus. So much to report. The US bus, another name for walking school bus, ended the school year with 3 new volunteer drivers, 5 new student passengers, and the interest of 3 new schools. Thanks to the Arlington Community Foundation, who provided a grant, we were able to keep the ball rolling, paying the inimitable, a fantastic Lauren Hassel for her focused time and energy on developing the very critical US bus website. And we have another thanks to the Alliance for helping that happen. For continued outreach, we now have flyers in multiple languages, including Arabic, when at the same time, she was volunteering her time herself as a driver of the US bus Purple Line. Plus, now we have a permanent Arlington school bus presence in the name of Kevin Treacle, who, by the way, is a retired Arlington County police officer and a very strong advocate of all of the things that's happening on the commission. Kevin Treacle is the school department's new transportation demand specialist who came on board in March. Kevin is very much a proponent of the walking school bus. Well, I foresee great happenings in 2023. So we're working hard and thinking harder.
Excellent, excellent. It's wonderful to see the program grow. That is great. That is great. Congratulations to you and to Andrea and all your partners.
I should add that we're focusing on not only the 4 basic pillars of happy aging. We've added the spam and older adult abuse. Evidence is manifest that older adults are very easily scammed, and the scams are becoming infinitely more sophisticated. So we're well on our road planning a series, probably 7 different programs to present in each of our senior centers on a rolling basis to help everybody become aware, to experience through the testimony of people who did get scammed. How did they allow themselves to get scammed? And what's around to help get out of trouble when you are scammed. I think it's a powerful new direction that every one of us can benefit from.
Great, wonderful. Certainly agree. Any questions of Link?
I have a couple of things I forgot. One is that participation has been greatly strengthened by William jumping in.
Nice.
He's the chair of the commission, will be an active member. He's been very active. Someone who's new, so he raises his hand every time.
Great.
They need a volunteer for something. And the other is that I'm on the breakfast committee, and I guess I'll continue after I go off the commission for the following year. Nobody else wants, but if there's somebody who likes to look for speakers and plan menus and table arrangements.
And this is the breakfast for NBAN.
Yeah, I'd be happy to do.
You don't mean just every breakfast.
If it's something no one else wants to do, I'd be happy to continue.
That'd be dandy, if you would, and I'm thrilled to hear William's participation and his agreement to
I
step.
don't do any of those things I just said. I just.
We know. But I think being involved with NVAN is really important, and I appreciate your ongoing willingness to participate. Okay, now it's time for public information.
I think, Carlos was gonna talk first if he's around.
He is on.
Okay, Carlos is talking first.
Okay.
Hello, we are now in, hopefully you can hear me well.
Yep.
So we are now in the
Yes, we can hear
countdown
you.
phase for Cheryl's last days on the commission. And as a result, our next meeting, we're going to have a celebration to thank her for her contributions, but we want to also open it up as a way of recognizing, celebrating the contributions of Link and Herschel. So hopefully you can join us. It'll be hybrid. I'll be bringing some goodies to share. Those will not be supplied by hybrid means, unfortunately, only in person. So we're excited about that. And one of the things I have been pointing out to Cheryl is the fact that, you know, the board, obviously candidates election had to happen in terms of the primary. And I think it would be good to establish stronger relationships even before they're officially elected from the general election to our PIO meeting. So I'll be making an effort to inviting them to our celebration so that relationships can be established even now. And so it doesn't hurt at all. We did support the efforts to get the recording of our forum for the primary candidates out, and hopefully you all got them, and hopefully you distributed them widely within your social media platforms or even within your own, you know, email networks, because it's important for what we do to get out. And so that's what I have in terms of an update. Anything on your end, Cheryl?
No, I think you covered everything.
So there's a question in the chat, Carlos, on what is the date for Cheryl's celebration?
I think it's July 24th, for the PIO meeting.
Okay.
And as I said, it looks here, it's lower level room A.
Okay. So that's right next door here.
Exactly. All right, well, thank you so much. And hopefully I can make it. You take care.
Okay. Cheryl, do you have anything you wanted to add?
No, I'm a short timer.
So next meeting will be a discussion about the senior ambassador program, where we are. What you think some of the issues that they will be covering.
Yeah, I'm sorry, I should have said that, because Wendy's on. In fact, Wendy, you're right there right now. Maybe you could give a preview of what you and Michelle are gonna talk about at the next COA meeting.
The preview, but then why would people come? You know? No, Michelle McMahon is our project lead, and she's got an intern from Marymount University who's working with her. We're creating a steering committee, and that steering committee, we hope, will be able to meet for the first time before July 19th. It includes Brenda Cox, Rebecca Pearson from Culpeper Garden, and others. We're hoping that these are the folks who are talking on the ground to older adults and can offer us the feedback that we need. Certainly Helen from the county is going to be on. I'm going to sneak in my A&V update, if you don't mind, Cheryl, because it's related to this. And although I can't officially announce, all right? I can't officially announce.
Yes, that's fine.
I mean, it's embargoed until the 28th. But unofficially, we're really lucky in that the AARP Community Challenge Grant will be recognizing the Senior Ambassador Program. So, you know, I suspect that on Wednesday, we might have an announcement that A&V is going to be getting a grant to help support this program. Much like the commission got a grant a year or two ago to support the Cross Guard flag program. So I can't say that it's
wonderful. Yay.
Yeah, no, it's really, it's wonderful. I mean, and I think it's, you know, it's resources that we need, but also a great recognition, the quality of the program. I was told that there were 3,600 applications across the nation for these very limited grants. And it's not who you know, because the Virginia State AARP people were not part of the decision-making process. So this was one that we won 100% on the merit. So congratulations for everyone, including this friendly plan, and the recognition it's getting.
Terrific. That is fantastic. Congratulations.
I was just gonna add too that, since Wendy is on, she reminded me, well, I'm gonna be going off with the commission. Wendy has graciously invited me to become the host of the weekly A&B Coffee and Conversation. So, beginning in July, every Wednesday, the Coffee and Conversation, which A&B has been doing for, what, 10 years now? Wendy?
Almost, yes, yes. Since the very beginning, 9 years.
Exactly. Anita Walgren is moving on to other things, and so, so it's kind of interesting because between Aging Matters and Coffee and Conversation, I can probably get guests and help. But all that said, I will definitely do a shout out for the volunteers of A&B. I mean, they really work hard to put that program together, and there's usually like at least 30 people who come on.
That's wonderful.
To listen to the speakers, and it's always a great, so I have big shoes to fill, but starting a week from this Wednesday.
Nice.
For Coffee and Conversation.
That is wonderful. Congratulations to both of you and Wendy, your leadership.
Thank you.
Very appreciated. Very, very appreciated. Okay, any questions for these guys? If you want to be in on the first Coffee and Conversation, you can talk to Wendy or Cheryl later. Okay, finally, transportation, Jim.
All right, William and I have completed the 3 listening sessions with the community engagement with the community centers. That includes Arlington Mill, Walter Reed, and Langston Brown. We've also done the same with Culpeper Gardens and Mary Marshall, and Carlin is next on our target list, and Galleria is pulling that together. We really get 3 things from this, I think. Number 1 is we get an understanding of how people feel in general about transportation options in Arlington. The second thing we learn is any problems that they have or any benefits that they have that we didn't recognize before. We've got a lot of both of those. And then, of course, the third thing is that they like to be listened to. They like to have this session, and it's worked out very well. Including the community engagement forums, this will make 9 outreach programs and listening sessions that we put together. And I'm compiling a report of the things that we have learned from them. And that will be out after the Carlin meeting. We have 3 different plans and studies being done by the county. The first is the transit strategic plan. And you remember you heard from Paul Monnier not too long ago on that. There has been an update. I attended that meeting. It was really excellent. I think he's done a great job. Again, I've got a whole bunch of stuff that I'm not going to reveal to you today. But I am writing a report on that and trying to apply the things that we've learned from our outreach comments that we've learned in transit to that plan. He would like to hear from everybody who has comments by the end of July. The second is the plan Langston Boulevard, and they are again giving updates at the 4,500 Langston Boulevard Design Studio on 12 July. I will attend that. I've got a lot to do on that. There's a lot going on in Langston Boulevard. And the third is the South George Mason Drive multimodal study that is currently under review. And thanks to Joan for bringing that to my attention. I have the presentation now, and I'm starting to go through that. Let me just say that there's a lot going on, and there's always seems to be a lot going on in the county, and applying the desires of the older adults is pretty challenging. We really need help. We're a pretty small committee, and there's a lot of work to be done. So if anybody would like to volunteer, we need your help. Our quarterly meeting is scheduled for 18 July. And I had hoped to have someone present the South George Mason Drive multimodal study, but the person who led that, Leigh Gerber, has left the committee at the county, so I'm not sure. And I'm also not sure that we have enough people who are going to fulfill the quota, because everybody's going on vacation. So I may put that off. I'm going to do a survey of members. Joan, do you want to summarize the Transportation Commission?
Yes, I will make a few comments. That the Transportation Commission met on May 25th. I wasn't able to watch it that night, but then watched the video later. It was a very long meeting. It was almost 4 hours. So anyway, I just have a few little things that I'm going to mention. The Transportation Commission did vote to recommend that the county board approve a use permit for redevelopment of the Arlington Career Center. And that new construction will be, will house 1,619 students, have an above grade parking structure for 360 spaces. And the part of the Career Center they don't tear down is going to become the home of the Arlington Montessori program. They are already on site there, but they will be moving into the redeveloped site. Also, I thought it was interesting that recommendation allows for 512 on-street parking spaces in the neighborhood. That would go a lot of blocks, but that's part of the proposal. And then 170 bicycle parking spaces. Then another, and the county board approved this at their June 12th meeting. I mean, the Career Center redevelopment has been in the works for a while, but things keep changing. Then there was the proposal, or it was an information proposal. Now listen to what I say, future of outdoor dining. What does that spell? Food. Food, okay. So anyway, during the pandemic, there was emergency legislation for temporary outdoor seating arrangements. And that's what set up all of the outdoor dining we have. That expires August 15th. So the county board voted to advertise to consider extension of that at the July meeting. So there will be a decision made on that. I think that it will be approved again. This was an information item. And then the last thing, nearly $2.5 million in intersection upgrades were approved by the county board for these 3 intersections: Washington Boulevard at Glebe Road in Ballston, Washington Boulevard at North Patrick Henry Drive in Westover, and South Glebe Road at South East Street in Crystal City. There is an ongoing program to upgrade the intersections, but it was voted to put these up at the top of the list. And the Transportation Commission meets this Thursday. I'm going to try to watch online.
Wow, that's a lot.
Yeah, just a comment on the food extension. You know, there's nothing, there's no such thing as a free lunch, extending the analogy. And we've had a lot of complaints especially by older adults about the crowding of sidewalks. And so that's something we need to pay some attention to as we extend those permits. The only other thing I have is thanks to Joan, who found on Arlington Now that you recall county has converted 2 intersections
I have one. Yeah, I sent the Transit Advisory Committee has an annual tour of new capital projects, and I sent a notice to William, Jim about that, but presumably anyone else who'd be interested, but probably staff too, as far as that goes. I don't know what the particular places are that they're going to tour this time, but people could check with that if they're interested, or I could send around the invitation to anybody who's interested.
You want to send it to me, I'll send it out with your follow
Okay,
up so that.
I mean, there's always, in the past, it's not a star, a bus, and it's never been filled, so if people are interested.
Yeah, thank you, Herschel. I should have included that. And in fact, I'm going to be on the bus.
Great, great. Okay, so, I think we can, Erica, did you have anything to add for H friendly or?
No, just that, we will certainly be moving on now to look towards the next 5 years, and each of the committees should start thinking about their exciting input into the 5-year plan. So look forward to that.
Great, thank you.
Ellen, I'm still a member of the committee, and I was in the capacity of the PIO. So I don't know how that works in terms of who was on the task force. But that's how I ended up being on it. So since what Erica just said is to, the committees.
Okay.
You may want to follow up. I don't know if Carlos is still on.
Thank you, Chair. Okay, Jennifer, anything for the Alliance or for Senior Adult Council? I know Andrea's not with us today.
Yes, she asked me to just give you a quick update, a few highlights that have happened. On June 1st, we were excited to bring back our annual 55+ leadership luncheon at the Jefferson again this year. This is the first time we've had it since COVID. So we were excited to have that, and Christian Dorsey and Libby Garvey were able to join us that day. The Alliance had their annual fundraiser with Rocklands on June 13th, and it seemed to be a success. So thank you for everybody that came out to that. One of the big things is the National Council on Aging actually visited with us on June 20th, so last week, and filmed at both Lover Run and Walter Reed. They were filming, they chose us along with 2 other community senior centers, I think in Baltimore County and Philadelphia. They're creating a video for Senior Center Month. So we're excited to see how that comes out. So we'll be sure to share that when we receive that. It'll be in September, which we're also currently planning for our September Senior Center Month. So the video should go along well with it. We've completed in the month of June, we were able to do some Pride programs around that. Our biggest one being the drag queen bingo that we held at Walter Reed. earlier in the month. We had about 30 people come out to that. And then we'll plan to offer more of those programs throughout the year. And the staff are already talking about us maybe having some kind of festival next June. And then the only other thing is on personnel update, we are still down 2 of our supervisors, but hope to have an update on our travel supervisor this week. So we'll either be having that person return or going out to hire soon. So that is all I have.
Great. Where are we? Any update on the Alexandria Commission on Aging?
No, they're taking me to summer home.
They are, okay, all right. Arlington Neighborhood Village, Wendy, I think gave, her report and her sneak preview, and I believe she's gone, is that correct?
Nope.
Wendy,
So-
are you still there? No, you're still there.
I'm here, but I've given my report. Move on.
Okay, all right, Commonwealth Council, Erica.
Yeah, so the Commonwealth Council Legislative Committee meets this Thursday, and we will be developing the Commonwealth Council platform to present to the full council, which meets on July 19th. And so I will have a report after that.
Erica, can I ask you a quick question? I know there's been some changes in the departmental structure at the state level. Is that correct? Or is that just been?
Yes, that's correct. So that comes from the Elevate Aging Task Force and from the bill that was passed by the General Assembly last year. And as a result, there will be a new division within DARS, and it will be a division on aging. And so there is a position description out for the new director of the Division on Aging. So there will be, previously there was an umbrella a division, which was the Division of Community Living, which mirrors the federal community living, and that included aging. But now aging will be separate and apart, but obviously will work closely with the Division for Community Living.
That sounds great. And whenever things get a little more settled, if you could let us know so we give you some time to kind of cover that with us, I think that could be important.
Sure, of course.
Everybody's on to dementia friendly. Okay, steering committee for older persons, Cheryl.
Yeah, they did not do the meeting in May, so it's going to be in July 21st. The topic is advocating for nursing home residents. I guess it's July 21st. Yes. Anyway, 9:30 and 10. And I think, Alan, I'm sorry I keep dumping on you here, but this would be another good, opportunity to get somebody, especially somebody who's involved in the actual services for older persons. I don't know if we have somebody on the commission here, but I think it would be helpful to, again, transition. I've been on this committee for 6 years, and I'm not sure I'm always gonna be here to give the, the report.
Okay. Thank you, Cheryl. All right, any questions of Cheryl? Old business. New business. Okay, our next meeting is on July 17th, and it's virtual.
It is an all virtual meeting for the next one.
Okay, cool. All right. Well, have a great summer, you all, and we'll see you in September and see you virtually in July. So for Audrey, if you have a few minutes or you want to get some coffee later?
I can't today, but I'm free tomorrow.
Okay, why don't you send me some time?
Okay, absolutely. I have a house in, Bluma, Boulevard Manor,